Today we are going to be talking about tips for effective communication with patients that have hearing disabilities. We are first going to talk about the importance of having good communication. Then we will talk about the challenges these patients currently face right now, specifically in the medical imaging department. We will then focus on ways to improve this communication and lastly talk about why it matters. I picked this topic because a lot of my family have hearing disabilities. My grandpa is deaf and I have cousins that have been born deaf too, so this topic is very important to me personally. Let's start diving deep into this presentation. Even as an X-ray student, all the communication you really practice for is very verbal. So, you have the patient come in and you're like, hi, like, what's your name? What are you here for? Are you pregnant? All of these questions that you're trained to ask are very verbal. And then you have them walk into your table and you're like, I need you to stand like this, or I need you to sit like that, put your hand like this. Positioning and even breathing exercises all depend on verbal cues or verbal communication. So when you have a patient who can't hear you, it can become very frustrating. To understand how to communicate with these patients, you need to understand what can cause hearing disabilities. So there are two types. One happens when your inner ear or auditory nerve is damaged. This is permanent. And the second is when sound waves cannot reach your inner ear, and this kind of hearing loss can be reversed with treatments or surgeries. As we can see, patients that have hearing disabilities currently feel like the people who are taking care of them are not trained to do so, and they are not very satisfied with their care. The two biggest outcomes of miscommunications are misunderstandings and lack of informed decisions. So, by having misunderstandings during communication with patients, it can cause an environment of mistrust. Like the patients won't feel very comfortable being in the room with a technologist that they feel they cannot communicate with in a scary part of their life. And as for the informed decisions in the procedural side of medical imaging, you cannot consent a patient who is not deemed fully informed, so that can delay any procedures, and it can also cause a patient to either accept or not accept a procedure that they really need or that they might not need because they're not fully aware of what you're trying to tell them. Let's talk about some of these challenges. It is stated that 30% of deaf people avoid seeing their doctors because of the issues that they have while they're in their visit. This is probably due to the fact that most people rely on their patients to be able to read their lips, although that might not be the preferred method of communication for that patient. As a result, if patients don't go to see their doctor, and this is in general, while their health issues are simple or small, eventually they might only go when the problem is big or urgent, and that might put the patient more at risk when it is time to get their treatment for their problem. This slide essentially states that most technologists rely on visual and physical cues when communicating with deaf patients, while very few of them are proficient in sign language. This just reiterates the fact that some technologists might feel inclined to use their method of communication that's simpler or more convenient for themselves rather than establishing what method of communication is preferred by the patient that they are communicating with. Having hearing disabilities is not exclusive to just patients. Radiographers can be the ones that have the hearing disabilities as well, and that is when you find more problems in giving or receiving informed consents or even verbal instructions during a visit. And it's not like technologists don't want to learn how to improve these experiences. They do. They just don't know how or haven't been told or trained on how to better improve their communication in these cases. So now let's talk about how to better improve our communication. There are many different ways to improve communications with patients that have hearing disabilities, and one of the most basic ones I can think of is sign language training for the staff. Knowing how to say hold your breath, don't move, like things like that, that would be very easy to learn. Having technology such as speech-to-text devices would be very convenient for informed consent, like getting informed consent, being able to explain what the procedure is, why they need it, the risks, and like being able to fully give them an idea of what they're going to be agreeing or not agreeing to is just the fundamentals that you need to get informed consent. Visual aids such as like written instructions for like really basic exams such as a chest x-ray would be very convenient. Having them know like, oh, I'm gonna have you stand here, you're gonna be facing this way, you're gonna have your shoulders forward, and you're gonna be holding your breath, like, that would make it very simple for the patient to understand the expectations of what they need to do for this exam, and could decrease like the misunderstandings between the technologist and the patient when it comes time to do the exam. Institutional policies would include like having a note in their patient record that they are deaf, so that the person knows the expectations of communications before even meeting the patient. Like they know like, oh, like the special needs of this patient is this, so I will be able to give them that by doing this, this, and this, and that can be having a tablet ready with an interpreter on it, and not having to scramble it as soon as they meet the patient. Things like that would just improve the communication between the patient and like the technologist. So why does it matter? Improving communication is very important, and hearing loss is very common. The challenges of communication between the technologist and patients are really being highlighted, and being able to improve upon that will lead to less errors or misunderstandings. The less errors in communicating with the patient will lead to less errors in the images that are acquired by doing so. And being able to reduce the amount of errors in images is important because you just end up repeating the exam, and that just increases the dose of radiation that you give to your patient, which as technologists we are trying to keep as low as possible anyways. And just showing human empathy and compassion to patients who are struggling because of their disabilities is just a great way to show that you care for them and that you care for their medical needs, and that is what they're here at the hospital for. Like they don't come to the hospital because they want to. They come there, they go there because they need to, so they should be treated with respect and dignity just as every other patient that walks through that door. And that is why I chose my topic to be this, because I really wanted to highlight how important it is to better improve your communication with patients with hearing disabilities. Thank you so much for listening to my presentation. I hope you enjoyed it. Here I have just a few of my resources that I used for this PowerPoint presentation. So thank you.